Hello, everyone. I'm so grateful that you're joining us on this video today because I have a special guest. This is Dr. Margo Anderson, and she is fantastic. We were just chatting before I started recording, and you guys are going to learn a lot from her today. So thank you so much for being here. Let me tell the group a little bit about you. So Dr. Anderson is a board-certified family medicine physician who is currently providing direct primary care near the New Orleans area in Louisiana. As a direct primary care physician, Dr. Anderson works with patients in person and via telehealth in an intimate way that allows for an ongoing relationship, providing meaningful and individualized care solutions. Dr. Anderson has a special interest in preventing or reversing disease through lifestyle modifications and completed the Integrative Medicine Residency Program through the University of Arizona. She has a particular passion for caring for women with a focus on hormones and fertility and is a certified NAPRO medical consultant. We are so lucky that you're with us, Dr. Anderson, today, and no doubt we have so much to learn, and I have a lot of questions that we could easily get into the weeds with, so I feel like we should just get started. So thanks for being here.
All right. Well, thank you. Thanks for the introduction, and I'm very excited to be talking with you today.
Yeah, awesome. So Dr. Anderson, first question here is, how do you define infertility as a restorative reproductive physician in comparison to the traditional medical model?
So yeah, a few things about that. We'll start by just saying how the traditional model does it. They define infertility when a couple is having regular unprotected intercourse for a year and there's no pregnancy. So that's the regular definition. In restorative reproductive medicine, we first of all don't call infertility a diagnosis. We call it a symptom, because infertility itself, what is that? It means, you're not getting pregnant, but there's some sort of cause for that. It's not just that you're infertile, like what's causing it. So we like to look at it as a symptom of, and we're trying to find out what's causing the infertility. We do have sort of a time type of thing too, the way that traditional says within a year of trying. The great thing about restorative reproductive medicine is we have charting and fertility awareness. So like you teach the FEM method of charting, there are some other methods out there, but when a woman knows how to chart her cycle, she knows and learns when is her infertile times and when is her fertile times of the month. That's part of what you learn in charting. And based on that, we call it fertility focused intercourse. So you can choose to have intercourse on days where you are fertile. And so you're going to be doing a better job than someone who's just randomly having intercourse hoping to get pregnant, but they don't have that information that the chart provides them. So when a woman is having fertility focused intercourse, having the knowledge of charting, when she's doing that for 6 months and there's no pregnancy, in restorative reproductive medicine, at that point we say there's an infertility problem. Mm-hmm. If the woman is over the age of 35 and she's been charting with fertility focused intercourse for at least 3 months, we say there's an infertility problem. So if it's an older woman that's trying to get pregnant, we start a little sooner. That being said, if I have a patient that comes to me and it's her first visit with me and she's been charting even just for a couple of months, she just started to learn how to chart, but she has a history of irregular cycles or pain or some issue, and her charting just in these past few months already reflects, me as the physician, I'm looking at that charting, using it in my diagnostic process. If we already see there's a problem, I'm not going to wait for 6 months for her to prove to me that she's not having fertility. There may be already some things that I can work on with her. And it's not necessarily just to make the fertility problem better, it's to make her healthier. So that, and that's what restorative reproductive medicine is all about. It's right there in the name, restorative. We're trying to restore healthy, a healthy body, and a healthy body is going to be a fertile, fertile at the right times of the month body.
Yeah. So Dr. Anderson, if you could put them into categories, what are the most common root causes of infertility for couples trying to conceive? and the general restorative treatment approaches that are available to them.
Okay, so I sent you a little picture. If you could pull that up. So this graphic I borrowed from a Dr. Phil Boyle, who is a restorative reproductive physician in Ireland. And he gave a presentation that included this graphic, and I thought it was great because it really does. You mentioned what are the root causes. Well, here they are. You'll notice the red bubble, others to be discovered, because, you know, this is a science. There may be things in the future that we figure out that we don't know yet. But the ones that we do know, all those blue circles, are things that we do evaluate as part of my workup. You know, I'm thinking about all these things. And the way I figure out which one might be your problem, it starts with taking the history from the patient, learning who they are, what their lifestyle is like, what medical problems they have been diagnosed with or not. And then the second step would be looking at that chart. The chart is a huge, important piece. So we look at the woman's chart and how things, you know, there's different patterns we see on there, and that clues us into some things that may be going on. After that, we're typically doing blood work. You know, some of the things you see on there, like low hormones, that can be looked at through blood work. You know, that includes, you know, not just estrogen and progesterone, but testosterone, thyroid hormone. You know, there's a few others, but those are, you know, some things there. Another thing that I really feel strongly about, that blue bubble on the right, male factor. I think a lot of times the males are forgotten about. And one of the, if it's infertility that we're working on, one of the, and miscarriage too, actually, one of the first things we've got to do is a semen analysis on the guy and see what's going on there. And there are some, depending on if there's a problem, or, you know, there are some things that can be done for that. And just the overall health of both members of the, you know, the couple, getting them both healthy. So yeah, these are, you know, the blue bubbles, and that's kind of where we start, and a good framework to think of. You know, this chart isn't all inclusive, but it's a good kind of overview of what we're looking at.
Bring you back there. So based on the root causes that we just looked at, the blue bubbles and the red bubble, what would be your advice for a woman listening to this video in terms of where to start when seeking restorative treatment?
Yeah, so we've said this a lot, the charting is so important, because it's your compass of what's going on with your body. There's so much a woman, when she learns how to chart, there's so much she will learn about basic physiology and basic, you know, what's going on with her body that she never realized. Because a lot of women, they know they are having their period, and hopefully they're having it about once a month. That would be what's normal. Some people, it's not like that. But just tracking, I mean, I had a patient the other day, I asked her, you know, do you track your cycle in any way? And she said, I use this app, and it was an app where you track your period. I mean, that's good. That's some sort of information, but between the periods, there is so much that happens, you know, that you learn how to track with charting. So that's the first place, is you've got to get connected with a teacher that teaches. There are some, you know, there's several different methods of learning how to chart, and some are better than others. And so finding, you know, that teacher and learning how to chart, and, you know, kind of meeting regularly with your teacher to do that is the first step. And then after that, a lot of the different charting teachers, some of them may already work with a physician or know physicians that they can refer to. As far as restorative reproductive medicine, you know, I'm a NAPRO medical consultant, so that's how I've been trained. And any NAPRO doctor is going to be able to offer this sort of treatment. They're, you know, you're trained in FEM charting. So FEM is also a wonderful method of charting. You know, NAPRO's uses the Creighton model, so that's Creighton models of hormone charting and FEM method. There's also a medical training that goes along with the FEM method. And so there are some physicians out there that have done that training. And there's another one that is neofertility is another form of training for physicians. So you want to look for a physician that has had some training in these realms, because if you go to your regular family doctor or OB/GYN doctor, they did not learn this in medical school. They're not going to be able to help you. Most doctors have never seen a fertility chart and they won't know what they're looking at. So you have to have a physician that's been trained in this and knows how to look at it and use it.
Yeah, absolutely. I think too, it probably comes back to having the education from a trained educator is really, really
Right.
useful, because I often find people that are going out wading into the waters of Google on their own. It can be really overwhelming, and it's nice to subscribe to a standardized method where you have an educator who's kind of guiding you through the process, so that the data you're collecting is accurate. I think that's also really important, right? Because you want to, as a physician, you want to look at a chart where the data is accurate, it's clean, it's ready to go, so that treatment can be expedited for that person. So I think
definitely.
One thing to take home from that is educators are helpful. So get one if you don't have one. So, Dr. Anderson, women who are diagnosed with PCOS or endometriosis often worry that they will be infertile or struggle with infertility, at present. Can you speak to how restorative approaches can give hope to these women with these issues when it comes to achieving pregnancy?
Yes, definitely. It all goes back to the way that we diagnose and treat. I'm not going to say that restorative reproductive medicine, is going to guarantee everyone a pregnancy or solve everyone's problems, but it's really the only place where there can be workup and treatment and success for helping with things like endometriosis and PCOS. In the traditional model, for example, in endometriosis, a woman that has this problem, if she is not trying to get pregnant, she's usually offered birth control, which doesn't treat the problem. It just kind of suppresses everything. And then if she is trying to get pregnant, there's surgery, and that, can also be part of restorative reproductive medicine too. But one thing that is so important about what we do is, because we do have the charting and the fertility awareness, we can address these things a lot earlier than they may have been looked at. I'll give this example. Just a couple of days ago, I had a girl in my office who was 16 years old, and she has irregular cycles, and she didn't know anything about charting yet, but I explained, just started the process of explaining it to her and how it could be a benefit to her. And she said to me, she said, almost in sort of a shy, way, I asked my mom if I could be infertile. And my mom said, I don't know, and it's when you have those young teenage girls that have irregular cycles, and if they go to a regular doctor, they'll, usually get put on birth control. And what happens in that situation is you might be 15 years old, start taking birth control, you take it for a while, you're 25, 26 maybe, and you get married and you're ready to start a family, and you stop your birth control, and then what happens? The problem's still there. So then, and potentially could be worse because it was left untreated. And what we do in restorative reproductive medicine is we take that 14, 15-year-old, teach her how to chart, correct the problem, and then she's ready to, when she's ready to have her family, she can do it and do it and be healthy and prepared for that. And so that's the difference in what we can offer.
Yeah, no, that's really powerful, I think, for people, especially now who are experiencing this, that might resonate with some people that might be them, right? Coming off the pill after 10 years or whatever and struggling and whatnot. But I think the take home message for, if that's you, a listener listening to this, is that there are restorative approaches to these issues. And I think there's hope in that. So it's obviously something that's not being offered widely by the medical community, but there are people like you, Dr. Anderson, that are offering it. And so we need to take advantage of it. It's great. Speaking to the pill, for women listeners who are coming off the pill or are pill users currently, can you speak to how hormonal contraceptives may impact their fertility?
Yeah. So yeah, there's a lot to that question. We
Yeah.
kind of talked about, could do a whole talk on it by itself. But one of the big things that I just touched on a second ago was that oftentimes people get put on the pill because there's some problem. So they go to their doctor and they say, having these weird cycles, they only come every 90 days, they're really irregular, or I'm having lots of bleeding and it's really heavy, or I'm having lots of pain and I can't go to school or can't do work because my period is so painful, or PMS is just driving me crazy, and all these problems. And the doctor says, okay, we'll put you on the pill to regulate your cycle. And I hate when they say regulate your cycle, because it just suppresses everything and turns it off. It doesn't regulate it. But so what happens in that situation is she gets put on the pill, and it doesn't fix anything. Like we said, it doesn't restore her to health. And so your question, how might that impact fertility? Well, it just sort of puts a Band-Aid on whatever problem she's having. And then when she gets off the pill and she's ready to get pregnant, the problem is still there. So that's the concern with using birth control, is that you're not treating what may be going on. So those women, there's some women that are on the birth control pill for 10 years and they get off of it and they have a baby the next month. And that happens, but for other women, they get off the pill and their period doesn't come back, or they, or something, there's just the irregularity was not addressed. So that's a big issue. There's other things that, have been looked at with the pill, as far as changing your gut microbiome, nutrient deficiencies, things like that. And so in general, when you get on the birth control pill, you're taking, you're shutting down a physiologic process that is a normal, healthy part of a woman. And so when that's not there and you've been on the pill for 10 years, you don't know, your cycle, some people call it the fifth vital sign, or the sixth vital sign. Your cycle is, for a woman, is like a vital sign, because if you're having a regular, healthy cycle, things are good, so that's in another, when you're charting, you can determine if things are right or not right. And if you're on the birth control pill, you can't, because you've turned your cycle off. So yeah, I hope that answers the question.
No, absolutely. I feel like we could talk about all of this stuff for hours, because it's really fascinating, and it's so great to have an expert in it like you to speak to women. So I want to keep these videos short so that your glass of wine isn't empty by the time you're done watching it, women. But I also want to give you guys some resources for information that you can go to. So Dr. Anderson, why don't you tell everybody what your website is, because I don't want to say the name wrong.
Okay, yeah. It's simple, drmargotanderson.com.
Perfect. There you go.
Yeah.
Yeah, so she has a blog. I was perusing it this week. It's really helpful. And can listeners contact you through your blog?
Yeah, I think there's a thing on there where you can send in a comment or a question.
Yeah,
and
cool.
I've got a Facebook page and an Instagram. It's all pretty new, and I'm not the social media guru by any means, but I'm putting a little bit out there.
I think we'll get you some likes from the video, so we'll do that. So go follow Dr. Margot Anderson for updates from her. Really, really great education as well on the blog that is already available to women that want to see it. And also, if you want to get started with charting, like we talked about in this conversation, there's multiple methods, and there are actually many, many providers across the United States that are willing and ready to help women who are experiencing infertility or are realizing other issues as they start charting. And we can connect you with them. I'm a FEM educator, but we have a wide range of educators that are just really excited to help any woman that wants to start the charting journey. So you can visit www.truefem.org for information on that. And again, go see drmargotanderson.com for the blog. Follow her on Instagram. Let's get her some followers because she's awesome. And we want all of this information out there in the world. So again, we just thank you so much for being here. And we will look forward to maybe another video coming up soon about another burning topic that people want to know about. So thank you, Dr. Anderson. Appreciate you being here.
Yeah, thank you.